a new machine learning system could give physicians a risk scores for different treatments. Sepsis claims the lives of nearly 270,000 people in the US each year. The unpredictable medical condition can progress rapidly, leading to a swift drop in blood pressure, tissue damage, multiple organ failure, and death. Prompt interventions by medical professionals saves lives. But some sepsis treatments can also contribute to a patient's deterioration, so choosing the optimal therapy can be a difficult task. For instance, in the early hours of severe sepsis, administering too much fluid intravenously can increase a patient's risk of death. To help clinicians avoid remedies that may potentially contribute to a patient's death, researchers at MIT and elsewhere have developed a machine learning model that could be used to identify treatments that pose a higher risk than other options. Their model can also warn doctors when a septic patient is approaching a medical dead end, that is, the point when the patient will most likely die no matter what treatment is used, so that they can intervene before it is too late. When applied to a dataset of sepsis patients in a hospital intensive care unit, the researchers' model indicated that about 12% of treatments given to patients who died were harmful. The study also reveals that about 3% of patients who did not survive entered a medical dead end up to 48 hours before they died. This research project was spurred by a 2019 research paper that explored the use of reinforcement learning in situations where it is too dangerous to explore arbitrary actions, which makes it difficult to generate enough data to effectively train algorithms. This situation where more data cannot be proactively collected are known as offline settings. In reinforcement learning, the algorithm is trained through trial and error and learns to take actions that maximize its accumulation of reward. But in a healthcare setting, it is nearly impossible to generate enough data for these models to learn the optimal treatment, since it isn't ethical to experiment with possible treatment strategies. So the researchers flipped the reinforcement learning on its head. They used the limited data from a hospital ICU to train a reinforcement learning model to identify treatments to avoid, with the goal of keeping a patient from entering a medical dead end. Learning what to avoid is more statistically efficient approach that requires fewer data. To develop their approach, called Dead End Discovery DED, they created two copies of a neural network. The first neural network focuses only on negative outcomes when a patient died, and the second network only focuses on positive outcomes when a patient survived. Using two neural networks separately enabled the researchers to detect a risky treatment in one and then confirm it using the other. They fed each neural network patient health statistics and a proposed treatment. The networks output an estimated value of that treatment and also evaluate the probability the patient will enter a medical dead end. The researchers compared those estimates to set the thresholds to see if the situation raises any flags. A yellow flag means that a patient is entering an area of concern, while a red flag identifies a situation where it is very likely the patient will not recover. The researchers tested their model using a dataset of patients presumed to be septic from Beth Israel Deaconess Medical Center Intensive Care Unit. This dataset contains about 19,300 admissions with observations drawn from a 72-hour period centered around when the patients first manifest symptoms of sepsis. Their results confirmed that some patients in the dataset encountered medical dead ends. The researchers also found that 20 to 40% of patients who did not survive raised at least one yellow flag prior to their death, and many raised that flag at least 48 hours before they died. The results also showed that when comparing the trends of patients who survived versus patients who died, once a patient raises their first flag, there is a very sharp deviation in the value of administered treatments. The window of time around the first flag is a critical point when making treatment decisions. Moving forward, the researchers also want to estimate causal relationships between treatment decisions and the evolution of patient health. They plan to continue enhancing the model so it can create uncertainty estimates around treatment values that would help doctors make more informed decisions. Another way to provide further validation of the model would be to apply it to data from other hospitals, which they hope to do in the future.